Good morning and welcome to this week's Ask Dr. Murphy This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest headlines through today, February 6th. Any questions or comments are welcome down below or at any of our social media. Starting with those questions, we have a follow-up from last week on the botulism outbreak linked to canned tuna. Dr. Murphy, can you tell us the exact locations where those cans went out to, and do we still have to be on the lookout?
It's been a little bit quiet, but we do know where those cans went to. They were from Tri-Union Seafoods, which makes or supplies several other companies and stuff that get sold under the brand Genova Yellow Fin and Van Camp canned tuna. 9 states. So Illinois, Indiana, Kentucky, Michigan, Ohio, and Wisconsin. Giant food locations in Massachusetts and Virginia, and Safeway, Albertsons, Vons, and Pavilion stores in California. So of the affected cans, their best buy dates have all passed. So that's good news. There's nothing out. If you've got canned anything past the due date, you shouldn't be opening it anyway. So that's really kind of the story. So it can happen.
Yes, preemptive alert on that one. There were no known illnesses linked to it, but still important.
Really good.
Mm-hmm.
Good public health.
Very good. And we had a very good question from a longtime viewer, so thank you for submitting. And they are concerned about the Nipah virus outbreak in India. And I understand there have maybe been some cases in Bangladesh or Pakistan as well. But how serious is this virus? How fast can it spread? And should we be concerned here in the US?
Yeah, Nipah virus was first reported or identified in 1998. It had been around before that, obviously, but we figured out that it existed in 1998. And it's been reported in Bangladesh, India, Malaysia, the Philippines, and Singapore. And the reason why it's important, although there's not lots of cases, the case fatality rate is 40 to 75%. So if you get it, it's really, really serious. So in this current thing that's going on now, there's only 2 confirmed cases in 2026, and those are in India. Nipah virus is transmitted from animals, can be fruit bats, pigs, horses, but it can also be transmitted through contaminated food or through direct contact with an infected individual. But it's obviously not very easy to transmit because the numbers are so low. But, boy, if you get it, it's really bad. But nothing in the US, so we're good.
Yeah, when you hear person-to-person transmission is possible, I personally get worried. I start thinking about COVID, but important to recognize this is not a respiratory illness that's spreading that way.
So anything spread respiratory-wise, like measles and COVID, and flu and RSV, I mean, that's, the numbers are astronomical.
Mm-hmm. And right on that topic, once we get into COVID, how did these latest COVID vaccines fare against severe disease? We had a lot of different variants going around. How did they do?
Well, as the season is going along, the data is just coming in, so, you're getting like early reports, partial reports. So now we're a year after the last season, the 24-25 season. So we're in the 25-26 season. So now all that data is in, so they can actually take a really good look and see, how bad it was, so how good it was. So this was published in JAMA Network Open, which is a very prestigious medical journal. And they looked at the effect of the COVID vaccines against severe disease, and they found that it worked about 40% preventing hospitalization and 79% preventing ICU admission with ventilation or death. So it prevented better the sicker aspects of COVID. COVID is still, causing deaths. Approximately 8,500 adults were, of which 1,888, which had COVID, were analyzed in the last season. And importantly, the vaccine showed similar efficacy throughout the entire period, even as the virus was evolving. And this was a study done by the CDC, and multiple university medical schools participated in this, including the University of Michigan, Yale, Temple, Wake Forest, and Johns Hopkins, and many others. So it's a nice report just showing, yes, these vaccines do work, and they prevent you from getting really sick, and works quite well.
And on that topic of vaccines keeping people alive, keeping people healthy, there was just a new massive report from the WHO, World Health Organization, on the impact that improved flu vaccines could have if everybody took them. What were those numbers like?
Well, better vaccines and more people taking them. So it's really a combination of things. It's estimated by real epidemiologists that actually do this for a career and have studied their entire life about how these things spread, not just somebody who was in private practice who's now in a position of leadership that thinks they know everything. But they estimate that between 6.2 and 6.6 million deaths globally could be prevented. And that's a lot of people. Some million. There's some countries that don't even have that many people.
Absolutely. It's like twice the
like
size of the city of Chicago.
The entire state of Wisconsin, a little over 5 million. So
lots of people.
It just shows you how important these things are on a global basis, because any respiratory disease is global. Sorry, you can do what you want, but you're going to get impacted by what's going on globally.
And sticking with the big three respiratory illnesses, let's go to RSV, respiratory syncytial virus, where we have a lot of different studies now showing that there are long-term effects from infection. Can you tell us about those findings?
Yeah, it's usually the kind of the right after the infection is what we're talking about, in the year after infection, 1 month, 3 months, 6 months, 1 year. And similar to COVID, RSV, which stands for respiratory syncytial virus, they have found, because there's these big databases that follow these people, that in adults 50 and older who had RSV had higher rates of cardiac events like heart failure and ischemic heart disease, which ended up in intensive care unit visits, hospital visits, and mortality. And we see the same thing with COVID. Not so much with influenza, but COVID and RSV are more severe and can cause even more problems. And so the takeaway really is RSV in older populations, because the RSV vaccine is the one that's just for people who are older. It's more than just a mild respiratory disease. About 10,000 people a year die from it directly. And then you've got all these other people having all these, heart attacks and cardiac failure and stuff like that. Now, they may have been a little sick beforehand or whatever. It's not really quite clear, but it does increase that risk.
So if you are older and eligible for that RSV vaccine, definitely something to check out and speak to your doctor about. It could be life-saving.
Yes, it could.
Now, quick measles update. Cases have not slowed down. Can you bring us the latest from this week?
No, the vaccine rate is going down and the cases are going up. So South Carolina is the measles epicenter right now. They had their outbreak has reached at least 876 cases, which makes it bigger than the outbreak in West Texas, where it first took off. And overall, there have been, just this year alone, 733 confirmed cases, an increase of 145 just from last week. 94% are in unvaccinated or unknown patients who are driving this epidemic, and 23 of these cases in the last week have been hospitalized. Cases are now confirmed in 20 states. In this ongoing measles thing. Illinois, no, but we had our problems before, but Illinois has no cases.
Mm-hmm. And as a reminder, every Friday, the CDC is updating their measles count. So if you would like to stay up to date on those measles cases, you can find the CDC tracker. It is still being updated. But our final story for today, another reminder to stay away from raw milk. In New Mexico, there is an infant death linked to raw milk, and there's a popular influencer brand who's recently having some troubles with their raw milk. Can you bring us all the details?
Yeah, it's very unfortunate. A newborn baby in the state of New Mexico died, and this is linked to the mother's ingestion of raw milk that had listeria, which is one of the big pathogens in milk that has not been pasteurized. So that's the linkage there for that one. And then another one in Utah, where they were, the health department was preliminarily checking. They found a popular brand called Ballerina Farm, located east of Park City, Utah, paused their sales of raw milk after tests found high bacteria levels, including coliforms. That means E. coli is in there, which can also be very devastating and kill you. And so they stopped the selling of those products. But it doesn't really, it's good that they tested it and they got it, out of the public sphere as quickly as they did. But raw dairy products are notorious for listeria, killed this baby here, E. coli, salmonella, and all these other preventable bacterial diseases. So that's why it's not recommended for human consumption, raw milk, because of all these particular problems. So unfortunately, that's a risk you take if you take raw milk. Pasteurization does kill all those bacteria.
Absolutely. And like you said, it doesn't matter where you get the raw
Yeah.
dairy from,
No.
it still runs the risk of having those
No, I
issues.
mean, not, the Park City area in Utah has a very good public health department, and kudos to them for checking and identifying this high risk product on the market right now. So not
Mhm.
everyone's going to be so lucky.
Yes, but on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise this morning, bringing us all the latest news, answering our questions, and keeping us informed. So thank you very much.
Well, thank you, Katie.
And thank you all for joining us for this week's Ask Dr. Murphy in Public Health. And we'll see you next week. Any questions or comments down below. Have a great weekend.
Have a great week.